Hey everyone, and welcome to another episode of Finch Med. Today we're talking about the electrical conduction system of the heart. So we'll start today with a very quick, very amateur rendition of a heart. Now remember mechanically that we have 4 different regions of the heart that are pumping blood around. We have the right atrium, the right ventricle, the left atrium, and the left ventricle. Now, the role of the right atrium is to accept blood from the body, and that's coming in through the superior vena cava and the inferior vena cava. And the right atrium is then pumping the blood into the right ventricle. The right ventricle's job is to then pump blood from the heart to the lungs, and then it comes back to the heart. It comes into the left atrium, which is then pumping blood into the left ventricle. The left ventricle then is pumping blood out of the heart into the body. And so that's just a real quick review of what's pumping and where it's pumping. But that's mechanical. What is stimulating all those cells to pump that blood? And that's electrical impulses. And so that electrical anatomy is really what we're going to focus on today. If you have a healthy heart and everything's working just like it should, those impulses start in the SA node, the sinoatrial node. Now, where does the SA node get its blood supply? The SA node gets its blood supply about 60% of the time from the right coronary artery. A little less than 40% of the time, it gets it from the left coronary artery. And so in a small minority of cases, some people have dual blood supply to the SA node, which is really great. So the impulse that is stimulating contraction of the heart, if everything's working right, is coming from the SA node. So where does this impulse want to go? Well, the first stop is going to be the AV node. The AV node is also in the wall of the right atrium and much closer to the ventricles. How does it get there? It gets there through 3 pathways called the internodal pathways. And these are high-speed electrical pathways that are going to get the signal to the AV node. We also have the left atrial tissue. How are we going to supply that? That's supplied through Bachmann's bundle. So just remember that for your anatomy test. Bachmann's bundle goes from the SA node to the left atrium. So now we're at the AV node. What is the role of the AV node? Why do we have one? Why don't we just go straight from the SA node into the ventricles? Well, the job of the AV node is to slow down that electrical signal. Why would we want to do that? Well, the electrical signal is traveling faster than the muscle cells can contract in the atria. Now, we really want the ventricles to fill all the way up. And so to do that, we have to give the muscle in the atria time to contract down and push that blood into the ventricles. And so a main function of the AV node is to delay the electrical transmission from the atria to the ventricles so that the ventricles can be filled up. So now we're at the AV node, but we want to move down into the ventricle. How do we do that? You do that with the bundle of His. Bundle of His. Now, on some anatomy tests, you're going to be asked, in a normal heart, what is the only connection between the atria and the ventricles electrically? And your answer will be just that, the bundle of His. And the bundle of His then splits. It's in the interventricular septum, and it needs to supply the right ventricle and the left ventricle. So to the right ventricle, it sends what's called the right bundle branch. And then to the left ventricle, it sends the left bundle branch. And now you say, but there seems to be more branches in the left ventricle. And that's right, because the left bundle branch splits into the left posterior fascicle and the left anterior fascicle. So, and I'll write that down here. We're talking about left posterior fascicle. And the way I really remember this is that the left ventricle is pumping really hard. Remember, it's pumping blood out to the whole body. And so I just remember that it has more electrical supply. Now that's not the scientific explanation, but it's an anatomy reference you can use. The left ventricle is pumping harder, so we're sending more electricity down there. That's just one way I remember it. So we have now the electrical conduction to the areas we want, but it's not plugged into the muscle. How do we do that? So there are these fibers on the ends of the bundle branches and the fascicles, and this is the Purkinje. The Purkinje system. And the Purkinje system is just that. It takes the electrical system off the highway, which are the bundle branches, and plugs it directly into the endocardium, into the myocardial cells. And the myocardial cells are the ones that contract. And so the Purkinje system is like the exit from the highway into the myocardial cells, which are doing the contracting. So we've really covered in this video a quick review of how the blood's flowing, but mainly how the electrical impulses generated in the SA node in a healthy heart distribute all over the heart.